Dr. N.K. Pandey, Chairman, Managing Director, Asian Institute of Medical Sciences. One of the major challenges in organ transplant today in our country is perhaps availability of organ, infrastructure which we need for organ transplant, and also the post-operative care of transplanted patient. So these are the three major challenges that we face. As far as the organ transplant itself is concerned, it's a big issue. If you look at the India's data, if you look at the load of diabetes in the country, load of hypertensive in the country, that will give you some clue that what kind of figure that we are talking about. So if we take it that 10% of the population on average is diabetic, if we take it that 10% of the population is hypertensive, and then we talk about heart failure, then the failure numbers becomes huge. I can't quote you a data because our data, all India data, I have not looked at it recently, so I can't quote you a data. But at any given time, there are large number of heart failure patients who are struggling to get some kind of a treatment, and they have gone beyond the treatment of medicine. So pills are not the answer. So what do you do? And these patients require some kind of support, left ventricular support, right ventricular support, or they look for heart transplant. But that is one section. Transplant itself is a big area. So then there is kidney transplant, we face the same problem. Liver transplant, we face the same problem. Then we have people that we have seen in COVID time, that we have large number of patients who had terminal lung failure. And at that time we got totally exposed that we didn't have availability of lung transplant. Perhaps there was only one organization did a single transplant here. So most of the patient has to travel to the south. It's a very obscure data. So when you look at healthcare, if you look at medical education, more than 60% of the medical colleges are in the south. If you look at the organ transplant, most of the donation comes from the south, and the waiting list for this was so long to get a lung or a heart transplant that we thought that we need to strengthen this program in North India as well. And that is the reason that we had this meeting today. When we look at any organ transplant, be it heart, be it lungs, be it liver, be it kidney, cost is a very important factor. And when we look at cost, there are three components of cost. One is pre-operative cost, the second is operative cost, and third is post-operative management. So whenever we put in a foreign organ inside you, so there is a reaction, antibody antigen reaction, and the body is trying to reject it. To control that rejection, we have to use drugs, and that are very expensive. So when we are talking about long-term survival of these patients, we are talking about the huge cost input that goes into management of these patients, apart from what is visible to the people, which is the transplant as such. And that is where I think that there is a role of the government, because we have to bring some participative working where these patients can be supported by the government in terms of supporting their aftercare, giving them drugs, immunosuppressant at better rate, or even helping hospital to create infrastructure, give them land at subsidized cost, ask them to keep the cost of their transplant down. So it can be in terms of waiving of duties, import duties. So there is various things that government can do to help the institution. In the end, the government can ask to reduce the cost. So I think government has got very important role. The other role is on training and skill development, and that is where I think the proactively these skills needs to be promoted, and this needs to be mentored, and that is where also I think government can play a very important role. Today we signed a collaboration agreement with MGM Healthcare Chennai and Asian Institute of Medical Sciences for development of transplant program. And basically what we are looking for is how we can benefit from a very large experience that this institute had. So they have done close to 500 cardiac transplant and 80-90 lung transplant. Working together, we thought that perhaps the team can work together, they can perhaps operate together, perhaps our team can be part of organ harvesting. So if an organ is available, then nobody needs to come all the way from Chennai. Asian team can harvest, or perhaps we can be the center where transplant can be done, because time is a very important factor. Particularly in heart, we have 5-6 hours window to actually remove the heart, put it in the new patient and start the heart beating. And when you are fighting with time, then lot of logistic comes in, and that is where we can be helpful, because if you are going to lift a heart from somewhere in Odisha or Bihar and then you are transporting it very long distance, then lot of logistic starts playing into it. So the purpose was that how we can deliver better care, how we can give transplant facility to the more patients, how we can make our transplant outcomes better, and how we can control the cost. Eventually, the cost is to be borne by somebody. Unfortunately, at the moment, the patient pays all the cost. So, how we can economize? So, these are 4-5 points that we want to address to this collaboration. Our future plan will be that our institute gets recognized as major cardiac and lung transplant center. I would like to see a future in our institute that we do not have to rush the patient to another state for this high-end problems, and next time something like COVID comes or something, a different pandemic comes, we are much better prepared to handle the complication, because this time we felt that on part of terminal lung failure, we totally failed in terms that this facility was hardly available in North India.